And so super thrilled to have Odette today, Dr. Odette Suter. Where are you coming from today, Dr. Odette?
I'm in still chilly Chicago area, but getting better. Yeah.
And
Perfect.
would you like to share with us your bio? What's your history? How did you become who you are?
Yeah, that's a good question. Life just kind of slapped me over the face a few times to kind of get me aligned. Well, I always tell people that I was born weird and I only got weirder. So that's how I became a holistic vet. Funnily enough, I didn't even like animals when I was a kid. Mom wanted to, bring a dog into the family. And I'm like, yeah, no, I don't think we need a dog. And it was always my sister who would bring home animals, cats, rabbits, guinea pigs, turtles. She was the one. And she also was the one who dragged me to the horse barn, kicking and screaming, basically, and, making me spend my Christmas money on riding lessons. And anyways, eventually I got hooked on them. And
that's so
became
funny.
a veterinarian, but I don't have any animals myself, so I'm really weird.
That is hilarious. You are like the reluctant veterinarian, aren't you?
Yeah, and I hate hair. I hate having dog hair all over me too. So I'm like, I don't know how that happens. I mean, obviously I love them. That goes without saying. But yeah, if you look at who I am, really, you'd think that I should have been something completely different.
That is hilarious. You are the most unique story of anyone I've ever interviewed. Most people grew up with this massive passion for animals. And I actually don't love birds that much. And I hate to admit it, but and I've worked for bird rescues and things like that, but I dread birds. Birds don't like me either, though.
It's same here. When there's a goose around, I always get attacked. I used to, work with horses more, and some of these farms, they had geese, and I always had to have something in my hand to smack them over the head because they would always attack me, which was really awful, and I'm like, I don't know.
That is so funny. When I worked at bird rescue, they'd give me an umbrella for the geese. So you could shoot it out there and get after them. Yeah,
that's a good idea.
I'm a lover of defending from geese. That's awesome.
Yeah.
I have a cool story that's totally unrelated to this. Is one of my clients, geese, she was picking weeds and it attacked the back of her neck, and it was a Canadian goose they rehab from a broken limb. And she asked me about it. She goes, this goose attacked me. And and this is a goose that lives in their home, literally. And I'm like, I don't know what's up. Turned out she had a brain tumor back there. And it knew it saw it, and it sensed it, and it was trying to peck it out. So I had new respect for birds at that point. Every creature seems to be way more in tune than us.
Oh yeah. We humans are the ones who are not quite right.
Isn't that strange that we're the ones running the planet and we're the ones with hands and we're so detached?
Yeah, well, if you look at how we are running the planet, we're not doing a very good job at it, frankly.
Yeah.
I mean, look at all the toxicity and the damage and the health issues. And I mean, we are so dysfunctional on this planet at this point. It's sad, but I think the planet is also a place where we can learn and grow and make experiences and course correct as needed and so on. So I think it's good learning ground, and hopefully the planet is going to survive. But I think we're kind of getting hit in the head a little bit from all directions. So
I always say that we are a product of our conveniences. So because we've run into using plastics for everything, like when our society's too lazy to cut up apples and has a company slice them up and put them into bags, there's a problem there. My sister wrote The Plastic Ocean, and we've been into plastic research and studies. She actually found, and this is I think this ties in really great with who you are, because I consider you like Dr. Detox, right?
Well, actually, that name is taken by Dr. D. Blanco. Her first name is D-E-E, so she calls herself Dr. Detox. So that name is already taken. So
darn it, I can't. Thank you for clarifying. I love Dr. D. Blanco.
Yeah.
She is really amazing. And you also, so she just had her pet summit, which I loved. And you're going to have a pet summit coming up really soon. What is it?
May 13th through 18.
That's awesome. So
and it's a dog detox summit, but you know, it's for more than just dogs. It's for everybody, really. We just called it that, but it's for cats, dogs, fish, humans, bees, birds, everybody, planet, you know. So we're definitely taking this far beyond just milk thistle and the liver in this detox. So it's really more about just turning this planet around. Yeah, so amazing speakers, including Zach Bush, which I know you know of. He's a visionary and changer and transformer of this planet. So yeah, they're very incredible that I was able to actually get to him and get him to, you know, be part of the summit. That was really quite incredible. Had to pull some strings.
Yeah, I was wondering how you got him, because I know he's very, very difficult. So mad respect for all of you on that.
Mm-hmm. Thank you. Yeah, it was definitely a labor of love. I totally I don't think I felt this creative ever in my entire life, putting this together, because it's just my passion. You know, I have such incredible, infinite love for this planet and all of its inhabitants, including all the bugs, as in microbes, and other bugs. Ticks, maybe not so much, but still they're there for a reason. Anyways, I have such a love and passion, and it's just such perfect timing to make big changes, because with this whole pandemic, there's been everybody's life has been disrupted. And when there's a big disruption going on like that, there's a huge potential for transformation and change and growth. And so this summit has been, you know, creating this summit has just been such, you know, such a labor of love. And it's brought me so much joy to create it. And, you know, amazing people who have helped me, obviously the Pet Summit team, and then all my colleagues and other people who are contributing through interviews and presentations. It's just really quite incredible. And yeah, I'm hoping everybody is sharing it, because we really need to make a big splash. You know, so everybody is a little, I call everybody a little pebble in the pond. If everybody makes waves, there'll be a big wave. And so, you know, I appreciate everybody.
I will make sure I drop the link to that. And if you guys haven't been on the pet summits before, you're really missing out. There's some amazing, incredible information.
Mm-hmm.
They're pre-recorded, and then they have live streams on YouTube where you Q&A, right, Odette?
Yeah, there will be 2 Q&As during that time.
Okay. Well, you can count me in. You know, I'm fangirling on Zach Bush.
Yeah.
So,
yeah, and thank you too for having me here, and for, you know, for inviting me, and for everything that you do, because I know you're huge in creating transformation for people, and you are such a giving person. You have such a big heart, and you are also very talented with what you do. So thank you.
that is so sweet of you. Thank you very much. So because of the planetary concern and how toxic we really are, like I said, my sister actually wrote The Plastic Ocean with Captain Moore, and my dog's barking in the back, you guys. I'm super sorry about that. I want to yell at him, but I can mute myself when Dr. Odette goes and talks, and he's barking.
No worries. You know, I tune it out because I'm used to bark. Don't worry.
You're used to it. I don't know if our listeners are used to it. Well, but the plastic's a big concern. My sister was an orchid grower. She actually got a contract a grant from the government to use plastic bags as potting soil because she's all about reusing and recycling. And what she found about using those plastic bags is the orchids, there are orchid growers and orchid geneticists, my sister and her husband, they found out that the plastic bags made the blooms 3 months early and highly aggressive because of the xenoestrogens in them. And so that started all of us on this crazy research of how hardcore plastics are and how I feel like we're creating like this estrogen dominant androgynous race. What is your thoughts on that?
Well, I think we do have more females on the planet now than we have males, right? And some of the amphibians are, male amphibians are actually having female organs and are also reproducing like a female, which that's a little crazy. Plus then, all the other issues that we have from xenoestrogens, including, cancer growth. Well, estrogens basically are pro-inflammatory when they're imbalanced. Obviously, we all need estrogen, so if there's too little of it, we female humans, we notice that with hot flashes and that sort of thing. But when there's too much estrogen, what happens is it creates inflammation in the body and all sorts of problems as a result. Estrogen creates a little bit more leaky blood vessels, and leaky blood vessels then have things from the blood that go into the tissues, and the tissues don't like that very much, and so the immune system has to clean it up. And whenever we have the immune system doing something, then it means that it's creating inflammation, and chronic inflammation is not a good thing for the body. It really hates that. It causes a lot of damage of organs and everything else, including mitochondria, which, I'm going to tie that back to cancer because this is a cancer group. So it causes damage of the mitochondria as a result because of that constant inflammation that's going on. And mitochondria are the ones, these little organelles in the cells that really are like ancient microbes in a way. And so these little organelles, when they don't make enough energy, then the cells can't function properly. And then as a result, they become weird and they can turn into cancerous cells as a result. So
that it's such a big topic. And I think if you haven't heard this discussion before, it's needed. And so when we talk about inflammatory responses, is that a metabolic issue, or is that like what we call autoimmune, or what is that? How do you categorize that, Odette?
Well, I always say there's only one disease, and that disease is the malfunctioning of cells. And there are two causes for disease. One is a deficiency of certain nutrients, and then the second one is an excess of something, basically toxins. So either the cells are not getting what they need, so they're deficient, or they're being poisoned by something, so they're getting too much of something. And so when we have malfunctioning of cells, I just lost my train of thought now. I can't remember where I was going with that. Oh dear.
You were talking about there's like one major source of disease, which I've never really heard before. I'm digging on this.
Yeah, well, because the thing is, we have all these different names for diseases. We have diabetes, we have hypothyroidism, we have autoimmune, we have whatever, the disease is called, but it's all the same. It's just malfunctioning of certain cells, and we just have to figure out why these cells are malfunctioning. Are they deficient in something, or are they being poisoned, which usually it's both going on at the same time. So anyways, I remember where I was going with that. It was the metabolic question. So basically, any type of metabolic disease is just one of these, disease names that we use to say what's going on, but it's still malfunctioning. So again, it's either a deficiency or a toxicity of something. So that's basically the underlying cause. And so we just have to figure out what's missing and what's toxic. But people always ask me, why is my dog having diarrhea? Why is my dog having cancer? Is it this or that I did? And I'm like, well, maybe, but it could be so many other things. And in this world right now, the way we've set it up, we've not set it up for health. We've set it up for disease, basically. So we have toxins that are coming from every direction, including EMFs, electromagnetic radiation, which most people do not want to look at that because, talk about convenience. Everybody wants to have their phone. Everyone wants to have their whatever Wi-Fi smart things that are really not smart. Everybody wants to have their stupid watches, their smart watches, which I'm like, that's just the worst thing. I mean, why would you want to create cancer right in your wrist, right? And then possibly lose your hand down the road. I'm like, that makes no sense to me. But anyways, that's one of my soapboxes. But anyway, so we have toxins coming from everywhere. Plus we have deficiency that is causing problems as well because of, everything that we're spraying on the grounds, the monoculture, the over farming of soils, basically the abuse of the planet. So we have all of that going on, plus then add the human stress to it that also affects the animals. So there's really no one cause that we can find anymore. So looking for that is pointless. And asking the question of, you do have to ask the question, what is causing it? Because you have to start eliminating some of these things and replenishing nutrients. Like, for example, if you're feeding a highly processed kibble diet that's loaded with soy, corn, and other, junk that is no help to the animal and is so far removed from what they would eat in the wild, you cannot expect things to get better, of course. So we do have to look at, what are the things that are causing it that we have control over. But basically, we have to nourish the terrain. So we have to remove the things that are affecting it that we can control. And then we just have to boost the body and support the body to function properly and provide it what it really needs. And that's, a little bit of the difficulty that we have, especially after we've just had a pandemic, and I think it's still going on. I'm not sure. I don't really keep track of it anymore, but, we're so much into killing things. We want to kill viruses. We want to kill bacteria. We want to kill parasites. We want to kill just about everything. So we're kind of in a kill mode. But what we need to do is we need to get away from the killing, because the healthier the body is, the better it can actually deal with these things. So we have to nourish the terrain. And I think that's really the only way that we can create health, is to nourish the terrain. And I'm not saying that, if an animal has parasites, that we shouldn't, also remove those. And if they have a bacterial infection, that we shouldn't use antibiotics, because otherwise they could die. Or, we need to do a little bit of both, because if the body is so overwhelmed with what it needs to deal with, that it doesn't have enough life force to deal with it, then we certainly need to help that. I'm not completely against the having to remove microbes if we need to, but we need to focus on supporting the body so that it can deal with it itself.
So I guess what you're saying is the bottom line is balance, where we can find the terrain balance in our body, that we're not just antibacterial soaps always drive me crazy, because there's good bacteria too. So if you're killing the good bacteria, then we're constantly in this flux of imbalances, which I think goes back to your initial statement, is there's only one real cause of disease. And I love that. I've never heard that before. That makes
it's not mine. I picked it up somewhere, but yeah.
You're so humble. You're like, I'm super not taking credit for that.
No, I'm not taking credit for much of anything, because I'm just a product of learning from others, and picking up things, and certainly some of it is my own experience too. But yeah,
we have to be lifelong learners, and we have to be resilient. And I love the fact that you feel more creative now during this Pet Summit experience that you did. In homeopathy, one of their definitions of health is being creative. So if you're not being creative, you might not be as healthy as you can. But it also sounds You mentioned something about, how we're always fighting disease. So it could be a mindset aspect too, right? Do you think mindset plays a lot into this?
Yeah, definitely. Because, when we're stressed out and worried and everything, the cortisol level goes up, the stress hormone, and that affects how the immune system then works and everything else, because all of the hormones work really closely together. And so if there's an imbalance of one, it will create imbalance in all of the other ones as well. So definitely that plays a huge role. And based on studies, they've shown that chronic levels of stress is actually more damaging than chain smoking.
Wow.
Yeah.
Crazy. I had no idea. That's scary.
Yeah, I know, because I'm experiencing a bit of stress from working too much, so I'm like, I'm gonna have, in a few months I'll but I think in the end, if you're doing what you're enjoying, and if you have some joy in life, and you can be aware of when you're stressed and when you're afraid, and can sort of surrender that to, I call it, the higher powers, and I think that can help too, because we can't start to be afraid of everything either.
Absolutely.
Which, we have that. I mean, it's the survival instinct, because otherwise we wouldn't survive. But are we going to believe that survival instinct all the time? Or are we just going to say, oh yeah, thank you, I hear you, but you know, I'm going to ignore you a little bit. So.
Right. And then we live on caffeine, the caffeination of the United States. Absolutely.
Yeah.
So we get this rush, drop, crash, rush. But yes, balance, once again, going back to that balance. So can you define, since we wanted to talk primarily about metabolic issues, what does that look like?
What do you mean?
Like if a pet owner is seeing like chronic allergies, or their pet is obese and they can't get it to drop weight, or just lethargic, things like the common symptoms. I'm like reeling the conversation back to basic.
Yeah. Well, I mean, common symptoms can be, there are all sorts of them, and I have a whole list here. Can't think otherwise. Well, any kind of chronic skin issue. Oops, sorry, I was putting it in front of my phone. Yeah, so any kind of chronic skin condition, including allergies, hypersensitivity to fleas, smelling, yeasty sort of bacterial overgrowth, dermatitis, and then autoimmune issues. Obviously, cancer is also a metabolic disease. Failure to respond to vaccines, for example, as well. Not that I'm necessarily promoting vaccines, but that can also affect it, because in metabolic issues, the immune system is not working the way it's supposed to. So if an animal is exposed to a virus or something that is supposed to stimulate the immune system, including vaccines, then they may not be able to respond, appropriately. And then, of course, the all present digestive issues, including IBD, reflux, those types of things can also be metabolically driven. Decrease in vitality, resistance to infection, malabsorption, any kind of dysregulation in the gut, kidney issues, chronic liver disease, obesity. In cats, a lot of times, these stress urinary tract infections or urinary tract inflammations, which it's usually more inflammation than actual infection in cats. Premature aging, fertility issues, seizures, anorexia, fatigue,
Wow.
susceptibility to stress, all of the behavior issues that we see as well, they often have a relationship back to hormone imbalances and metabolic issues, because we see a lot more of that these days than we ever used to.
That's insane.
Yeah.
So even the IBD, I never really thought of that being metabolic. So what are the actual metabolic categories or disease names that we should be paying attention to if our dogs have this, or cats, or horses?
Mhm. Well, I mean, some of the most common ones are diabetes and insulin resistance. Those are definitely metabolic diseases. When we look at other, well, metabolic diseases are often driven by hormone imbalances as well. So any type of thyroid issues, hypo or hyperthyroid, depending on the animals. Dogs tend to be more hypo thyroid, and others, like cats, more hyperthyroid. And then any sort of other type of hormonal imbalances with, as we mentioned earlier, the increase of estrogen, for example, causes metabolic issues.
So Cushing's, Addison's, Flechner, those are all metabolic issues. Are they, like, is Flechner actually an end product to the other stuff? Can you kind of dive deep? I'm a little confused about Flechner. I'm not, I had heard about it, but never really witnessed it. Or maybe I did witness it and had no idea what I was looking at. And then Dr. Margot Roman and Peter really brought Flechner to light. And we discussed Flechner in the membership the other day, and people freaked out. They were like, I think that's my dog. And I was like, okay, I'm going to get somebody that knows about this, not me. So here you are. Please feel free to dive into Cushing's, Addison's, Flechner, and what all of that is.
All right. So basically, all three of them have to do with the adrenal gland. Okay. So Cushing's disease is when there's too much cortisol being produced. And then can I share my screen? Do you mind?
Okay. Go ahead.
Let me just get to the adrenal one.
Dr. Odette, is this off your course? I know that you have a course too.
Yeah, it is.
That's awesome.
Yeah, so anyway, so we have the adrenal gland right here, and the adrenal gland has different layers, and this layer right here, I keep forgetting which layer is making what, but I think it's that red layer. Well, actually, I do have it here. So there are several layers of the adrenal gland. One of them makes aldosterone, which helps to regulate electrolytes and water, basically, and helps with kidney, to help retention of water and sodium in the kidneys. And then we have this layer right here, the zona reticularis, and that one makes the cortisol. So this, stress hormone cortisol. And then we have another zone that makes androgens, including estrogen, DHEA, and testosterone. So those are the adrenals. And then in the center, we have the medulla of the adrenal glands, and that one makes adrenaline and noradrenaline. So, when we have to pick up and tie our shoes and run as quickly as possible because a tiger comes, that's what, the adrenals kick out some adrenaline. But the adrenal glands, they are basically regulated by the, there's the hypothalamus in red right here that stimulates the pituitary gland, and the pituitary gland releases ACTH, which is adrenocorticotropic hormone, that then stimulates the zona fasciculata and the reticularis, so these two zones right here. And then we also have the sympathetic nervous system that innervates the medulla, which makes sense. We have the tiger, sympathetic nervous system kicks into gear and stimulates the adrenal glands. Well, maybe I don't remember what I have as far as slides go, but anyways, when we have too much adrenal hormone, like cortisol, when we have increase of that, it causes Cushing's disease. And I do have a slide somewhere. Where is it? Oh, here we go. So Cushing's disease. So that's what Cushing's disease would look like in a dog. They have this little poochy belly here, and they are losing, hair. And oftentimes they will also have some weakness in the tendons and ligaments, and so their legs will kind of look weaker. In a horse, on the other hand, they also have this pot belly look, but they make too much hair. So their hair just keeps growing and they look like little teddy bears, even in the middle of summer. And they lose a lot of their top line. So they lose a lot of the muscles right here. In dogs as well, they lose a lot of muscle. So there's a lot of muscle atrophy that happens when there's too much cortisol. And then if we don't have enough cortisol, that would be Addison's. And that's basically when the animal is not making any adrenal hormone, and that can also be aldosterone, not just a cortisol. And these dogs, in the beginning stages, they can have a lot of vomiting going on. So it depends a little bit on the degree to which the adrenal glands aren't working properly anymore and making enough hormones. But if it's really bad, then they go into shock, and they can die if they don't make enough cortisol, because cortisol, they need that to be able to live. But there's like a range in between having enough and not making any. And so it depends a little bit on where on that range the animal is. And then with Flechner syndrome, it's basically, Flechner syndrome really describes a little bit more of that range in between. And what he found, Flechner, what he found is that with decrease of adrenal hormone, decrease of cortisol, there is an increase in estrogen that happens. And I do have a slide for that. So basically the adrenal glands make cortisol. And when there's enough cortisol in the body, then it will signal to the pituitary gland to stop making ACTH, because it's like a thermostat. So if there's enough cortisol in the body, it's like the temperature in your room is warm enough, so then the thermostat will turn off. But if there's not enough cortisol happening, then the pituitary gland will continue to stimulate the adrenal gland through that ACTH. So the thermostat basically keeps being turned on. But because the adrenal glands are not making more cortisol or not capable of making more, then it's like beating a dead horse, basically. So not much happens. But the ACTH will also stimulate the adrenal glands to make more estrogen. And so when we have estrogen that rises, so that's the decrease, and then estrogen rises, that has an effect on different aspects of the body. So for one, it decreases the conversion of T3 to T4. So an animal may have sufficient amounts of T4, which is the inactive form of the thyroid hormone, but not enough T3, which is the active form of the thyroid hormone. And when there's not enough thyroid hormone in the body, nothing really works, because the thyroid hormone is necessary for all bodily functions to work properly. So if there's not enough thyroid hormone, it's like trying to bake a cake at 100 degrees. Nothing much will happen, right? But estrogen will also sit in the receptor sites at the periphery. At the periphery. So these little bubbles here, they're cells. And then these little Y things on top are receptors. And so when there's plenty of estrogen in the body, then these estrogen molecules will sit on these receptor sites. And these are the receptor sites for T3. So basically, and then T3 cannot attach, and it cannot signal the cell to do what it needs to. So that's a bit of an issue, obviously. But estrogen, when it goes high, it also imbalances the immune system, which then decreases immunoglobulins. And immunoglobulins are part of the immune system. So the immunoglobulins, they will attach to pathogens, to foods, to anything that the body deems an issue. And then because these immunoglobulins attach to that, and the immune cells are being triggered to do something with it. So they're basically kind of like a signal to the rest of the immune system that something needs to be taken care of. So anyways, these go down, and as a result, then the immune system is obviously not working as well. And IgA is of particular interest because it's present on all of the surface areas that have a connection to the outside world. And that includes the GI tract, the lungs, the bladder, the eyes, the nose, the mouth, the skin. And where do we see most issues these days? It's in the GI tract, with IBD, and then also on the skin with allergies. And IgA, IgG, IgM are also important for, cancer control and the immune system in general. So in any case, when we have too much estrogen, then that affects the immune system. And if we don't have enough cortisol, that will affect the immune system as well, because not enough cortisol limits what the immune system can do, and too much will limit it as well. So they need to have an ideal amount of cortisol to function properly, just like the body needs a adequate amount of T3 and T4 in order to function properly. So if there's not enough or too much of either one of those, it's a problem. And then the other thing that estrogen does is, as in the process, it dysregulates the immune system. And a dysregulation of the immune system is basically allergies, autoimmune disease, and cancer. So all of this does not really help with health, basically. So that was that. Does that make sense?
Oh my gosh, I've never seen this. Makes so much sense. I hope this helped all of you understand the biomechanism of Flechner. That helped me tremendously. I've never heard anybody explain it quite like that. And Dr. Roman even says horses can get it, which I've never.
Well, everybody.
Yeah.
Everybody with an adrenal gland can have it.
That's incredible. How do we get that diagnosed if we think that is our animal? It's not really well received. There's like some vets that don't believe in it.
Yeah, there's even controversy in the holistic field. Some holistic vets, use it all the time. I do, and others are completely like, they say that's not good, not right. But anyways, the way it's tested, it's a blood test, and it has to be sent to a special lab. It's called National Veterinary Diagnostic Services. They're in Texas. So it's pretty simple. You can have your vet draw the blood and send it in. They just have to have an account and send it in that way. It's not too difficult, but you may run into issues because certain vets may not want to open up an account with a different lab, and they would also have to, get a little educated on interpreting the test results, and then, what kind of treatment to use. So that may be a little bit more challenging, but it can be done, especially if you have an animal where your vet has tried everything. They may be more open to that as well, because they are trying to find a solution to help your animals. So
that's, so yes, having that conversation with your vet, that's very, very clinical. How do you have like this hack or this suggestion how to approach this with our veterinarians? Because I would think that early detection and getting on this early would be much better than waiting till your dog's having seizures and passing out and IBD and just.
Well, oftentimes as humans, we don't do anything until something hits. But there are definitely more people who are being more proactive about that. And certainly you could just ask. And every vet will respond differently, obviously, because we're all individuals, but never hurts to ask. And then if your vet is not really interested in running that test, you can also check with National Veterinary Diagnostic Services to see who's in your area who would be willing to run that test. Because they have veterinarians all over the country that do. So you can always find out. So just because one vet says no, doesn't mean that's the end of it. There are other vets. And then you can also check the AHVMA website. It's ahvma.org. It's for American Holistic Veterinary Medical Association. They have a list of holistic veterinarians. So you can also find a holistic vet in your area. And even if they don't necessarily do that test, you can ask them, and I'm sure they'd be more than willing to kind of look into it. And I always recommend Pets at Risk. I don't know if it looks like reversed on my screen. It's Al Flechner's book. It's really good. It goes into a lot more details and also shares his stories. He was the one who came up with that. And then another book I really like is Safe Use of Cortisol by Dr. Jeffries. I think he was a doctor. Anyways, he writes about it as well. So there's a lot of information out there. And, you know, well, the way Flechner syndrome is treated is to replace cortisol. So if we were to go back to that slide that I just showed you, if you add a little bit more cortisol, then everything will restore itself, basically the whole cycle, and everything will restore. But when we talk about steroids, people almost get a panic attack, like, oh no, you know, no steroids. Steroids have such a bad rep, and it's just so sad because steroids, the body needs steroids, and if there are not enough steroids there, the body cannot function the way it should, and it will affect everything, you know, on all levels. So I'm a huge fan of steroids, but I'm a huge fan of steroids at the right dose. The problem with side effects is when steroids are given at too high of a dose. So there are different dosages. So there is the physiologic dose, then there's the anti-inflammatory dose, and then there's the immunosuppressive dose. If you're above physiologic dose, you will see side effects, but if you're below that, you will also see issues. So you have to find the right level. And I always compare it to thyroid hormone, because a lot of people are just fine giving some thyroid hormone. You know, that thyroid hormones don't have that bad rep. Well, cortisol and steroids are exactly the same. If you have too little, you need to give a little bit to get to the right level. If you have too little thyroid hormone, you give a little to get to the right level, right? If you were to give too much thyroid hormone, you'd also have major issues, but nobody does that, right? Because we're not using thyroid hormone to suppress anything. Whereas with cortisol or, you know, steroids, they're used to suppress things as well. But if we get it to the right level, they do not have any side effects. And in fact, I use steroids in my practice with many animals, and it's made a huge difference in their life. One in particular that I can think of right now off the top of my head is a dog who he used to weigh 40 pounds. He was like morbidly obese. And I tried to figure out why. And, you know, we obviously decreased food. That didn't do anything. He did not lose any weight. I added a little thyroid hormone because he was borderline. That didn't do anything. And I did the Flechner test on him, but because, you know, his thyroid levels were normal, I'm like, well, I don't think I want to put him on cortisol, especially because he's that overweight. And we know that cortisol can also increase weight, you know, can cause weight gain. So then a couple months after, you know, when things just didn't work the way I hoped, I'm like, okay, well, his IgA level is so low. Let's just put him on some cortisol. And I did, and he finally started to lose weight. And it wasn't until I started adding some of these steroids back in that he started to lose weight. And he now weighs about 28 pounds. So he lost more than a quarter of his weight, and obviously a much happier camper. And then at some point, though, he started having a little bit of skin issues that were cortisol related. So we took him off of it, and he's still doing fine, you know. So that's just to show that steroids can make a huge difference in an animal's life. And another one is a 2-year-old Weimaraner, and Melissa is here so that I can talk about him. Anyways, he had some major issues as well of not wanting to do anything, not wanting to be touched, just, you know, major issues for a young dog that shouldn't be there. And his life has basically turned around. I keep getting emails with awesome updates. And, you know, it's not a straight road. Any kind of health, you know, health journeys, they have their little ups and downs. So we just have to look at things and re-examine if things aren't going as well as we think, and try other things and be open. But anyways, it can make a huge difference in animals when they have too little cortisol. It can really turn things around, and especially with allergies, IBD, and those types of things, cancer, I would definitely want to check that out, see if that's a potential, and then treat it if necessary.
Now, I never really thought of behavioral issues being a symptom of Flechner, but it can be, right? I mean, you just said this dog in particular was kind of skittish.
Yeah, yeah. Well, the thing is, if you don't feel well, your behavior is not going to be normal. If I'm tired, exhausted, and such, I get crabby, and I don't usually do that, but in theory, I could bite somebody's head off, right? So why would it be any different with animals if they don't feel well? Why would they feel confident? If you don't have hormones, you don't feel confident. You may be anxious all the time, and that's why nowadays a lot of behavior vets will tell you not to neuter and spay your animals because they can have more issues because of it. As you take away hormones, and hormones are chemical messengers basically in the body. If you take away the messengers, nothing works. I mean, it's like, when you didn't have your audio working, you could talk. If I can't lip read, I don't know what the hell. What are you saying? So if we don't have enough hormones, there's just no communication in the body happening to the degree that it should be. And if there's no communication, how would the cells know what they need to do if they don't get communication and feedback of what they need to do? So
the early spayed neuter animals and that suddenly turn grossly obese, should we be pursuing like a Flechner blood test?
Yeah, and I would definitely also check the thyroid levels for sure. See if there's any sort of autoimmune something or other going on. And then obviously the logical thing to do is also look at how much food they get, because spayed and neutered animals need less calories than intact animals. So, you also have to look at the obvious and how much exercise are they getting and that sort of thing. But then certainly look at hormones if, the basic things don't make a difference.
I'm watching the chat and there's a bunch of people saying my dog's Flechner, my dog's been diagnosed. And some of these are really young dogs that you would have never, ever thought that they would have been Flechner. So how would you address that? So steroid wise, but also diet, nutrition, lifestyle. Do you approach it also holistically, homeopathically? What else would you do?
Well, I'm not trained in homeopathy, so I can't speak to that, but definitely with diet. And it depends a little bit, if their IgA level is over, let's say 63, I generally try to affect the change more from a dietary nutrition sort of aspect, detox, fecal transplants, huge. The microbiome is huge, hugely important in general, but certainly for that as well. And I've seen dogs that were, kind of in the lower end of normal or just a bit below normal as far as Flechner's is concerned, where with just doing fecal transplants was bringing them up to normal. But it depends, a lot of dogs have been inbred, line bred, we are creating all these misshapen animals and then all of these doodles. Unfortunately, I see a lot of issues with all these doodles. They often have, their adrenal glands are probably just not developed properly. And Flechner found that a lot of these issues with adrenal glands were, from being overbred and such. And then we also have toxins that affect adrenal glands, because most toxins are fat soluble and they get stored in fatty tissue, and hormone glands are fatty tissue, so they get affected by that. So anyways, Flechner found that some of these animals had underdeveloped adrenal glands. So their adrenal glands are just too small to begin with. And then some of them had inflammation or congestion in them, some hemorrhage in the cortex, the parts that make the hormone. And then sometimes we can also have abnormal enzyme function in the body. So it's not necessarily that there's anything wrong with the adrenal glands, but it could be that the process of hormone transformation and such, which can be enzyme driven, is an issue. So there are many areas where the problem can be. So definitely, I always look at everything else as well, including, I call it the 7 pillars of health, which is diet and nutrition, because you cannot expect the body to function properly if it doesn't get the nutrients it needs. And the GI tract, if you have constant inflammation in the gastrointestinal tract, that will cause inflammation everywhere else in the body, including the brain and obviously also the adrenal glands. So fixing the gut with the microbiome, and then detox. Once an animal is somewhat more balanced, I never start out with detox, but definitely detoxification is important, because that will also relieve the stress on the immune system and the adrenal glands, because toxins are stressful to the body. Then the nervous system, well, it's a big deal, because so the hormones are the chemical messengers, and the nervous system is the electrical messenger, basically. So if we don't have that electrical messenger working properly as well, then things don't work. Because, for example, adrenal glands, they are innervated, they get nerve input. So if the nerve input to the adrenal glands is not optimal, then that's an issue. Then they can't function as well as they should. And then obviously hormones is one of the pillars. And then fitness and exercise, huge, very, very important. And then emotional and mental health, and that tends to be a bit more on the human side, because we affect our animals with how we feel and how we deal with life. No judgment. We all life is not a piece of cake on this planet, but that certainly plays a role as well. I think that was 7. I don't remember, but yeah. So the 7 pillars of health are hugely important. So we have to address everything, because oftentimes what I see is that people address one little piece and none of the others, and that then can't work. We have to address the whole picture, because the sum is greater, whatever. I can't remember how that goes now. But the sum of its part is greater, whatever. Aristotle said it. Look it up. Yeah, so anyways, if we put all the pieces of the puzzle together, we get more out of it than just doing one thing at a time.
And there's people in the chat asking, can weight loss also be a symptom?
Yes, yeah, definitely, because if the animal is not absorbing food as well as it should, it could definitely have some weight loss. And I do have a dog I'm currently working with. He has megaesophagus, and first time I met him, he was probably about 10 to 15 pounds underweight. And it wasn't until we started adding hormones that he actually started to gain weight. So a little thyroid and a little bit of adrenal hormone, and he's finally starting to gain weight. He's like a little skeleton, poor thing.
Oh, Dr. Odette, this has been such a great conversation. I could pick your brain all day, but I don't want to abuse you.
I have a few more minutes if you want. If you have time, if there are any other questions that people were asking, I want
to open it up to the members to ask you any questions. So you guys go ahead and turn your cameras back on if you want. I'm going to unpin us and ask away. So I know, Suzanne, you have a question. So unmute yourself, turn your video on, and ask away. Or I can ask for you if you guys aren't going to ask away. I see, let me move my screen around so I can see what we've got going. Suzanne, go ahead.
Can you hear me?
Yes.
Hi there. I had my dog tested both with Dr. G-Dad and with the Flechners, and her results came back from Flechners to be some problems, but my integrative vet sided with Dr. Jean Dodds and said that just disregard the Flechners. And I still, always in the back of my mind, wonder what I should do, but I don't really have anyone I can work with at this point that is willing to, help me along. I know our IgG and I think the IgA, those were, off. So my dog's got lots of problems that I'm working with, and I was just curious to see what you all thought, what I should do and how I should go about it.
Well, let me ask you this. With whatever your integrative vet is doing based on Dr. Dodd's testing and all that, did it improve?
We didn't do anything because Dr. Jean Dodd said that
Okay.
her thyroid tests all came back fine.
Mm-hmm. And, I totally respect Dr. Dodd's, no issues there. But if your dog is not improving with what is being done, then that's certainly something I would bring up to your vet and say, look, we are doing this, that, and the other. I don't see any change. So can we try? What do you have to lose? I mean, you put them on a little bit of steroids and a little bit of thyroid hormone and see how it goes, treat it for Flechner's. And if it doesn't go the way you think, you can always take them off slowly. So with any hormone therapy, if you start hormone therapy, you cannot stop it cold turkey.
Well,
but you can, I mean, you don't lose anything trying.
So I think the biggest problem is I don't know that my integrative vet actually knows what numbers to be watching and how to administer those things to monitor something. I think that's the biggest problem. And, like most integrative vets and holistic vets, they're slammed. They just don't have time to take time out and educate themselves is how it's really going at this point. So,
right. I understand, but I mean, their job is to help your dog. So give them the Flechner books, just drop it off, bring it to them. Buy them a copy and drop it off and tell them to read it.
It's funny is because I've done that with ozone and he's now picked up ozone and the IV therapy and he's picked up IV therapy. I'm like, come on, let's get with the program here. We got to do some more things here. And he's just like, I drive him nuts sometimes,
Yeah.
But I'm always pushing him. But she's 10 now. And when she was 3, she was diagnosed with autoimmune arthritis, and she was 120 pounds at the time, and they put her on prednisone at 100 milligrams a day because of her weight.
Wow. Yeah.
And I thought that was a lot. I consulted my integrative vet, Dr. Dodds, put her input in. She was going to physical therapy. That vet they all thought it was a very high dose, but they agreed with the dosing according to weight. And I said, I would never put her on something like that again because it was so awful to her, in my personal opinion. So I don't know. I'm just kind of like out here by myself pretty much in the woods.
Yeah, and I'm sorry about that, but it's nice that you're continuing to challenge your vet and just keep doing it, just keep doing it.
Dr. Suter, do you do online appointments? Like, is there any way that Suzanne can hire you and then maybe have this conversation between you and her vet, or is that offensive?
Well, I can certainly have a consultation with the vet if they want to learn, and talk to your vet. Right now, I'm not taking any new clients just because I'm working on that detox summit. So I need to have that kind of over first. And then I'm also finishing up with creating my, recording my educational course.
Well, I tried to get my vet to hook up with Dr. Margot to do the microbiome, and I couldn't get him to do that. And he interned with her years ago when he was young into the program.
Oh, really?
Yeah. So I do push the limits. And sometimes I think I push my luck with them, but I don't know. I've actually thought about driving. I'm probably about 6 hours from here to your place. And I just don't know if she could handle that kind of a ride.
Yeah, I hear you.
Yeah, and that was COVID. That was crazy. It just messed everything all up. So, but anyways, that's where I'm at my dog, and I have results sitting here that I feel like I need to do something with, and just not sure how to do it.
Yeah. I mean, I obviously, without seeing an animal, I can't make any recommendations anyway. But I'm more than happy to have a chat with your vet if he's interested. And maybe if you pay him for his time and all that, maybe he'd be willing to do that,
Yeah, and I offer to do all that. But when I walk in, he looks at me like, now what have you been studying? And I go every 2 weeks because we do acupuncture, cold laser, and chiropractic care. So I go every 2 weeks. So he never knows what I'm gonna walk in with. When I bring in a folder, he looks at me like, uh-oh.
Yeah, yeah. Well, I understand. We as vets are quite busy these days, especially with this after, from this whole pandemic. It's just been really rough on a lot of us. So
yeah,
I mean, understand.
Yeah, there's only so much time in a day, and I get it. And he has to have his mental break too. I totally understand that. So
yeah, but on the other hand, you have to be the advocate for your pet, and so you definitely want to work with that. And you could also check with Margot Roman and see if she does any phone consults too. She may be willing to do that if she has time. I don't know.
I don't think she can't. She's like in the same boat you are. She'd have to go through the vet to do it. And my biggest advocates are the vet techs. They're the ones that really nudge on him. We'll talk when he leaves the room, and we do cold laser and that. We're talking. She says, "Let me just talk to Dr. Matt, see what he'll do." So they always are pushing on him a little bit. So that's how we got ozone and the IV things. So, but anyways, that's where I'm at. And I appreciate you coming on and stimulating me again.
And I appreciate what you do, because the thing is that, change in the veterinary field is not coming from the veterinarians themselves. It's coming from all of you guys. So the more that you guys do and push, the more change will happen. So never underestimate what you're doing. Well, and even if your vet isn't picking up on it right now, he may think about it like with some other cases. And he's like, maybe I should really check that,
Right. Oh, yeah. Well, I'm just going to keep praying God opens the door here.
Yeah. Well, good for you. Good for you. Thanks for what you do.
Thank you. All right. I'll let everybody else talk.
Yeah. April, do you want to ask a question? Are you still awake? April's live streaming from across the world, and it's like 1:00 in the morning. So if she's not gonna, are you gonna?
Yeah, her eyes are still open.
Hello, I'm still here.
I told her I'd message her and say, "Are you awake?"
Yep, my eyes are still open. Yes, Dr. Suter, I just wanted to ask if ozone will actually help these metabolic disorders. Since I have an ozone machine, will it help if I do rectal insufflation on him? Yeah, I would definitely recommend doing that. That's a good idea. Thanks for thinking about that. Yeah, you could do ozone water. You could do that. But yeah, ozone helps because what it does is it helps the liver. It provides a little bit more oxygen. It also provides a little bit more energy. And the body kind of likes oxygen. So with more oxygen, everything works better. It also, ozone also has a way of getting the red blood cells to be not all bunched up together, because when they have more inflammation in the body, what happens is the red blood cells, they kind of attach to each other, kind of like a rouleau. Yeah, they call it a rouleau formation. So it's basically if you had a bunch of coins and you would just kind of, have one next to another, you'd have this roll of coins. So that's what happens with red blood cells as well. They can get clumped up together that way. And as a result, they cannot transport as much oxygen, and they get more sticky. So blood flow is decreased. And with a decrease of blood flow, you also have, more inflammation and such, when things are sticky. So if you can increase blood flow with ozone, that can certainly help. Exercise obviously helps with that too, because if you things have to move. But okay. I think we'll have to do rectal insufflation because it's impossible to make him drink ozone water.
Yeah, I've never drank it, but the smell of ozone I hate it.
Yeah.
So I could imagine how that would not be very tasty.
And what about bathing them in ozone? Because the skin is the largest organ.
Yeah, you can do that. Yeah. Actually, I have a dog patient where we basically took the whole dog and put him in a plastic bag outside, because if you use ozone air, you have to do it outside because it's irritating to the lungs otherwise. So anyways, we put him in a plastic bag and hooked the tube up, and then the ozone would go in there, and his whole body would then be treated that way. But you can also have ozone bubbling in bath water. So there are mats that do that. It's quite expensive though. I think that one of these things costs like $3,000. But in any case, ozone can help with the skin. Yeah, definitely.
So you actually limb bag the dog's whole body.
Yeah. Body
Yeah,
bag.
and it depends on the size of the dog, obviously. That was like a Cocker Spaniel. So it worked out.
And ozone rots plastic. So you have a small window there.
Yeah. I mean, we kept using the same plastic bag, but first time we used it, his body turned, I mean, his skin, not his skin, but his coat turned a little yellow. So there was definitely some plastic that got on him that way, but we gave him a bath and that kind of took care of that. But yeah, ozone and plastic don't go very well together. So you have to figure out which plastic to use. And I'm sure we should be able to find better one, but that's all we had available at the time. I don't think they make plastic bags that big with the whole body in it. I know O3 vets, they have plastic for limb bagging.
Okay, that's good to know. I actually didn't know that because I've limb bagged my own leg before.
Oh yeah?
Yeah. Note to self, ozone attracts yellow jackets. They love lightning. So when they smell the ozone, they swarm.
Oh really? Oh
So
God, yeah.
Just be careful.
Yeah. Oh, that's good to know. I had no idea.
I found that out kind of the hard way.
Interesting.
Yeah. So any other questions in the membership here before we let Dr. Odette go and live her life? Some people are asking about your course.
Yeah, my course, it's basically, how should I describe it? Well, I call it the Holistic Pet Health and Longevity Method. So it's a program that gives people education. So there are 9 lectures on the 7 pillars plus some other stuff. And then there are I do weekly Q&As that are live, where people can ask questions about their own animals and whatever questions come up from the lectures and so on. And so the Q&As, they're ongoing. So when people sign up for this program, they get the lectures, and then they can go through them at their own pace, because I'm re-recording them and have them on a learning platform. But in any case, then they can do that at their own pace, and they can have the weekly Q&As, so they can show up whenever they want for the Q&As, and they're ongoing for as long as I'm going to do this, which I'm planning on doing it for a while. And then there's also a community platform that's like a Facebook group, but it's not on Facebook, where people can have community. So yeah, you basically get me and other members of the community, of course, at your fingertips. And I started doing it because of the situation in the veterinary field, where people just can't get in, they can't get their questions answered, just because there's not enough workforce. Veterinarians, technicians, everybody's overworked because there's just not enough workforce. And so I decided to do that so that I can support people and also educate them, so that when they go to their vet, they already know more, and it's easier to have a better conversation with your vet, asking for what you want, knowing what you're looking at, and also having a place where you can ask questions and get deeper answers and that sort of thing. Because again, veterinarians don't have the time to respond to 20,000 emails and educate people in that way. So that's basically why I'm doing that. And so it's like you get the real basics at a deep level. So it's not just superficial.
So anybody can join this.
Yeah.
Whoops, I don't know what's going on there. Anyone can join this. Is it ongoing? Like, do you have like a launch, or like, can I just drop your link and people can hop in that whenever?
It's ongoing, basically. Yeah, so they
What's your
can
link?
drop in at any point. Let me find it. I can put it in the chat here.
Okay. And then the Pet Summit you guys, if you're not on their mailing list, I will drop the link also on that if Dr.
have-
Odette has that.
Yeah,
Or
yeah, I can
or-
add the link. Or do you have one?
I do. I have an email, so I can find it anywhere actually.
Right, but I'm asking, I mean, do you have your own link?
No, I don't. Not at all.
Okay, well then so this one is for the YouTube one. That's the webinar I did to talk more about the course and what it contains and such. So it's an educational thing, but then it also provides you the information on how to get in contact with me once you've watched that. Because what I do is I do a little interview with people to see if it's a fit, because I'm building a community of like-minded people who, are interested, and I just want to know if it's a fit for people, just to make sure. And that's the Detox Summit link. And I certainly would very, very much appreciate people sharing that link so that we can get so many people on that Detox Summit to spread the word, because it's a very powerful to transform, because we need this planet to change. We need to change because and I don't want to be a complete Debbie Downer, but we only have about 60 years of farmable soil left at this point, and disease rates are skyrocketing. So unless we change, we don't have a chance of surviving, basically. So now is the time. And so the Detox Summit really talks about a lot of these different things and what we can do. And it's not a downer sort of detox summit. It's a very, it's uplifting. So don't worry about that, but please share it with everybody, Facebook groups, your family, your entire world. The more people get on that, the more we can change this world. And again, all the little pebbles make a huge wave in the end. So please share. I would certainly be very, very grateful.
Yeah, the links are in the Facebook thread right now. You guys, you can grab that whenever you want. This live stream will stay in this Facebook group for replays. You can replay it as much as you want, and then I'll load a copy into the membership. The change has to start with us, you guys.
Yeah.
The animals are showing us our future, though. They are the canary in the coal mine. Like Odette said, there's amphibians who are having female organs in their body, and they're producing, there's lots of mutations going on. So the time is now.
Yeah, definitely. And thanks, Melissa. Yeah, the time is now, and we've also lost about 50% of the microbial diversity on this planet in the last, few decades, especially with this whole glyphosate, because it's an antibacterial, and that's terrible. I used to have really good success with doing fecal transplants just about 7 years ago, and that has significantly decreased. I don't get nearly the same results I used to get because of that, because our animals are, the disease rate and the severity of disease has skyrocketed in just the last 5 to 7 years, and even more so since COVID started. It's just, incredible amount of disease, and animals do not heal nearly as well as they did before. So we need to change. We really need to change. So.
Okay, you guys, on that happy note, go pick up some
thank
grass today. Go on out and do something great for the planet.
Yeah, and have fun, find some joy. I think that's going to be the best, is to find some joy somewhere. Find joy.
Absolutely, and balance is everything. So can't be all about work, and it can't be stressed out of our minds. I do think we are a community of PTSD people. So
yeah,
all right.
exactly.
Thank you so much for sharing your wisdom with us. It's been such an honor, and hopefully we can talk again.
Yeah.
People are raving about your class. So everyone I've talked about who's taken your class has loved it. There's no bad feedback at all. Not at all.
Yeah. No, I love my people. They're amazing. I feel more blessed than they do probably.
I feel the same way about my membership too.
Yeah.
Somebody
Thank-
asked about my membership. I'll put the link in later. This is not about me. This is about
Oh,
Dr.
it is, because I know you do a lot of courses and a lot of things as well, so you certainly should promote that too, because, we all have a lot to give, and so do you, so.
Well, I'll mention that the fun thing about the animal iridology is you can see the toxicity markings in the eye, you guys. It's pretty mind blowing. And then you can go through like a humic fulvic acid detox and you can see the eye literally clear up. So it's super fascinating. It's so exciting to see your program show up in the iris. And you can actually, as a pet owner, kind of gauge that. So that's fun. That's really fun. And it's a fun hack. So maybe
Yeah.
we'll talk more about that on another day.
Yeah, I definitely need to learn more about that. I've
I
never
think
really
you'll love it. Actually, I think you'll really dig that.
Mhm. Yeah. I will come back to you on that.
Let's do it. All right,
Yes.
you guys have a blast. Take care.
Yeah. Bye. Thank you so much.
Bye.
Thank you.
Bye.
Bye.